So in today's topic, we will be doing the topic of food services and food safety. Those who have the textbook of quality control management, please mention the page number in the chat box. So food services, safe food storage may include the following principles such as first in and first out. It's an inventory policy. Okay. Things that you have bought first has to be utilized first. Okay. Which helps ensure food is used before its expiration date. Okay, to make sure of that. So that is what we call as first in and first out. So here you can see here in the diagram, while storing, what came first was stored. Okay, while leaving from the storage, what came first leaves first. Okay, the blue box that came first, that will be utilized first. So that is FIFO, first in first out. In food, in the pantry, kitchen services, in the diet department, in the pantry services, this is what has to be followed. Whatever you have stored first has to be utilized first. Okay, perishables as well as non-perishable items. Okay. The food safety officer or quality coordinator is responsible for food safety officer and quality coordinator will be appointed by the hospital. Okay. A quality coordinator can also become a food safety officer in times of requirement. Okay, so these are the few following responsibilities that a quality coordinator or a food safety officer should check on. Implementing food safety requirements. Annually, requirements do change. Okay, so based on what is happening this year, what are the new standard rules and guidelines that are out in practice, that has to be implemented at every hospital. Any kitchen and dietary department, these rules have to be, the food safety rules have to be implemented. Okay, you have to make sure people follow the food safety requirements. One such example of a requirement is wearing hair caps. Okay, hair net or hair caps. People who cook food, who handle food, should always wear hair cap or hair nets. Follow basic hand hygiene before touching the food. Okay, before cooking the food, we're dealing with anything, any food or utensils, hand hygiene has to be followed. Okay, people who are sick, unwell, should not enter the kitchen. Okay, so these are the basic food safety requirements. So the food safety officer has to ensure that these rules are being followed. And monitoring and managing compliances. Okay, compliance is the same thing. Uh, if you if you are attending the infection control classes, okay, I have sent a checklist. Has anyone got that checklist from this session who is already who is also doing infection control classes? Have you received the checklist? I have asked you to WhatsApp me if you want the infection control checklist. Yeah, so some students have received it. So I'm putting my WhatsApp detail again in the chat box. That checklist can be used by quality coordinator or food safety officer as well. Okay, so WhatsApp me on this number. Okay, just tell me the food safety checklist. Okay, just put that in the WhatsApp chat. I'll forward you the checklist. Okay, that you can use. So that is a compliance. Okay, each and every point in that checklist is a compliance. Okay, not to wear any jewelries. Okay, in the hand while cooking the food. Do not directly touch the cooked food with hands. A proper storage temperature should be. kept for storage, okay, all those things. And investigating complaints. Since it is a kitchen and dietary departments, complaints will be there. You go to a restaurant, you must also have complaint about the food, okay? In regards to taste, or some hair was there, or some insect was there, something like that. So any complaints that comes from the client side, customer side, each and every complaint must be investigated. Each and every feedback should be reported and addressed. Providing adequate design, construction, and maintenance of food service facilities. They are also involved in making sure where the gas stove should be, where the hand washing place should be, how the kitchen should be constructed, where the ventilation should be, where the exhaust fan should be. Okay, all the equipments that are available in the in the dietary department, how it should be maintained. Okay, how preventive maintenance has to be done. Okay, these all should be checked by the food safety officer. Provide staff training, infection control training, food handling training, okay, spread of disease training, food safety guidelines training. Okay, these different topics will be there. Every quarterly, new training should be taught to the staff. Provide adequate food labeling. Each and every food that is stored in the pantry should be labeled, okay, along with expiration date, used by so and so date. Okay, it has to be labeled. Nominating a food safety supervisor. But if you are on leave, okay, if the officer is on leave, food safety officer will be on leave or not able to attend the duty, who will be responsible for taking care of all these rules. Okay, so you have to nominate a food safety supervisor. Developing and renewing food safety programs. Annually, some of the other changes come according to the CDC guidelines also. If there is any new guideline that comes into the food department, that guideline has to be looked after. Okay, that you have to make sure that you put that new guideline into your food safety program. Next you have is implementing and complying with accredited food safety program. Making sure that if there is any third party accreditation that you have got, okay, in some hospitals the kitchen will be ISO certified, okay, or if you're if you are in a hospital, your hospital will be NABH accredited, JC accredited, ISO accredited. Okay, if any accreditation body is there, okay, FSSAI accreditation will also be given to certain kitchens in India. FSSAI accreditation is also given. So based on this accreditation bodies, they will have certain principles and guidelines that your kitchen has to follow. You have to make sure you're complying with those guidelines. Otherwise, your accreditation will be cancelled. Okay. Arranging for audits once in 6 months or at least once a year, food safety audit has to be done. Either internal quality officers can do this audit, or you can call for an external third party for audit as well. Taking action to remedy non-compliances. If there are any non-compliances, if any staff is not following the guidelines, what action can be done? Okay, will they be suspended? New training will be given to them. Okay, where they will be put on duty? When can they rejoin duty? Okay, what action will be taken if in case of non-compliance? Okay, so that has to be done by officers. Coming to the class categories and requirements. The food departments are divided into class 1, class 2, and class 3. These are the categories of food. In different hospitals, different clinics, what kind of food that you sell determines what class of food supervising has to be done. Okay. So in class 1, any unit that sells a whole fruit or a vegetable, tea, coffee, juice, milk, confectionaries, chips, nuts, dried or glazed fruit, biscuits, slices of or cakes that are non-potentially hazardous because it is packaged. Okay. Every food that is packaged. Okay. Even in railway stations. Okay. The tea stalls, okay, and the small shops that you have, they are also class 1. In hospitals also, in usually in the OPD settings or near the entrance of the hospital, near the canteen of the hospital, you will find class 1 stalls. Okay, they don't cook food here. They only sell packaged food, tea, coffee, milk, juice, a whole fruit. Okay, not cut fruit or vegetable, only whole fruit. Uh, Packaged chips, cakes, etc. Anything that is packaged, not cooked, will be sold. That is a class 1. You will require a food. You will not require any food safety officer. The hospital itself can check for the hazards here. No need to appoint a food safety officer here. Okay. In class 2, unpacked food is given to patients, staff, or public other than food. Okay. It produces packaged food is also given. Along with that, some small fritters like samosas, vada pav. Okay, these things are made here. Okay, and they also have a risk of causing food poisoning. Okay, since there is a risk of causing food poisoning, a food safety officer will be appointed here. Okay, a food safety supervisor should be there. They have to be appointed. Okay, so class 2 food safety officer should be there because they sell food that could be potentially hazardous. Okay, it is cooked food. It is cooked. Okay, not a complete menu or a meal, but snacks and all that is cooked or at least fried here is sold. In class 3, it provides potentially hazardous food to 6 or more inpatients in a hospital or any healthcare facility. Okay, that is class 3. 6 or more patients are getting food, are getting meal from the hospital. It means that institution becomes a class 3. 6 or more children are given food. 6 or more attendants are given food. Okay, so that becomes a class 3 facility. Okay, so it processes ready to eat food, uh, includes potentially hazardous food that is for delivery by delivered mean organization. That can also be class 3. Conducts off-site catering, or it can conduct on-site catering as well. Some hospitals, they don't cook food on their own. They give it to a catering services. Catering services will bring the food. Okay. Okay. So that is a off-site catering. So that off-site catering becomes a class 3 category. Okay. And they possess sufficient risk to require higher level supervision and monitoring because they are highly potential of spreading any infections through food. Okay, so they definitely require a higher level supervision and monitoring. They can apply for accreditations as well. They should be licensed as well. Then food safety program systematically identify food safety hazards. Okay, under food safety program, there are certain steps. Okay, the first step is you have to identify what are food safety hazards. Okay, if you don't know what hazards are, you will not know how to prevent them. Only when you know there could be an earthquake, you will have a preventive strategy for it. Okay, at least when the earthquake happens, what to do, you will have a strategy for it. Only if you know there could be a fire hazard, that's why you have fire extinguishers, water hoses, sprinklers, smoke detectors. Why? Because you know there is a chance possibility of a fire hazard in the future. Okay, so first of all, you have to identify what are food safety hazards. Okay, there is a table in this chapter. You can just check there. Okay, different types of food safety hazards and what actions do you expect is given in that table. You can read that table later on. Okay, spread of certain infections, fire blast, boiler blast. Okay, cuts and abrasions that take place to the food handlers. So these are different types of hazards that can happen in the food safety department. First, after identifying the food safety hazards, identify where in the food handling operations hazards may occur. Okay, either from where you are getting your food, getting the raw materials. Okay, if you are not sourcing your raw materials from a good wholesaler, okay, they use a lot of pesticides, fertilizers, and all, which are potentially harmful for the health. Okay, they sell you stale fruits and vegetables, not the fresh one. Okay, so from where that is one point where a food handling hazard can happen. Okay, after coming to the after these resources reaching to your hospital, if you are not storing it properly, okay, uh, it will be another hazard. And even if it is stored properly, if the food handlers are not choosing the right utensils to uh, cook the food, if the waste handler the food handlers are not following hand hygiene technique, another hazard will arise. Okay, there could be cylinder blast or fire hazard in the kitchen. Okay, so each and every step of from the food resources being bought to the food being kept on the patient's plate. Okay, from this end to the other end, there are n number of procedures in between. Identify in each of these procedures where a potential hazards can occur. Okay. Once you identify these things, then you can formulate a systematic monitoring for the means of control. Okay. You can monitor these specific areas more carefully that no mistake can take place. Okay. And you can provide for appropriate corrective action when the hazard is found to be not under control. Some things are out of your control. Okay, if there is an oxygen leakage in the hospital and that led to a fire hazard which spread to the kitchen as well, it was not the mistake of the kitchen. Some external factors caused damage to the kitchen. Okay, so some certain things are not under your control. Okay, so what corrective actions can you take after the hazard has taken place? What can you do to go back to your full potential, learn from the mistake, how to avoid it? Okay, provide for regular review of program by the food service facilities to ensure if it is appropriate. Whatever corrective actions you have produced, you have made up, whatever monitoring strategies you have, okay, on a regular basis, it has to be reviewed. Okay, from the authorities, from the accreditation bodies, you should get a green stamp that okay, your methods of control are correct, that it is appropriate to use. So you can't blindly make some control measures. Whatever control measures you make, it has to be approved. Okay, only then it is considered appropriate. So you can see this organization of food safety program. Under food safety program, you have a plan, food safety plan, step-by-step plan. Who is responsible? What they have to do? Where they have to do? When they have to do? What they have to do? Okay, these answers you will get from the food safety plan. Monitoring, a food safety supervisor will be available to monitor the kitchen department, okay, thoroughly. Verification, seeing that you have a license, checking that you have an accreditation, okay, all those things come under verification. Under the food safety plan, you have all the risk assessments, identifying the hazards, written policies and procedures for each hazards, records of your employees' health, food handlers' health. Okay. So this is about food safety program.